Hi, y'all. My name is Claudia Lennhoff, and I'm the Executive Director of the Champaign County Healthcare Consumers. And I want to welcome everybody to this presentation of Medicare Open Enrollment. We have a slideshow for you, which is the presentation that we would normally do at a community meeting. And since we can't have a community meeting, we are making this presentation available widely. So I hope it can be helpful to folks. Okay, so we're going to start talking about Medicare Open Enrollment. And again, my name is Claudia Lennhoff, and I'm the Director of Champaign County Healthcare Consumers. I'm going to focus first on the basics of Medicare because there are some folks who will be watching this who are brand new to Medicare, and then others who have Medicare. It helps to review this information. So let's get started. Okay. The first thing to know about Medicare is that it has multiple parts for the types of coverage that it provides. Part A is hospital insurance. So this is if you are hospitalized. Part B is medical insurance. And Part B is really going to represent the bulk of your health insurance coverage because Part B covers doctor's visits and things like that. And we'll talk more specifics in a little bit. Part D is a relatively new part of Medicare. It is the prescription drug plan, and it is to cover your prescription drugs, and it began around 2005. And there is a Part C, but we will talk about that later. So Medicare Part A, your hospital insurance, first of all, it is free, meaning there is no monthly premium for most people who qualify for Medicare based on disability or who have worked and paid into the Medicare system or who were married to somebody who qualifies. If you do not qualify for free Medicare Part A, there are ways to pay in as well. So one of the things to know about Medicare Part A is that it has a projected deductible of about $1,452 in 2021 per hospitalization. So this means that if you have Medicare and you are hospitalized and you don't have any other health insurance, you will have to pay a Medicare deductible of about $1,400 or a little bit more. What your Medicare Part A covers is in-hospital overnight care. It will cover you for a certain number of days in a skilled nursing facility. For example, if you need rehab after a surgery, it can cover hospice care and some home health care. Now let's talk about Medicare Part B. This is your medical insurance. And as I said earlier, this is really the main part of your Medicare that you're going to use for your healthcare expenses. The monthly premium is projected to cost $153.30 and will be deducted from your Social Security benefits each month under most circumstances. Original Medicare Part B has a projected annual deductible of $212. That's the estimate for 2021. This would only be paid once because it's an annual deductible, but it is important to be aware of the monthly premiums and the deductible. Now, if you do not sign up for Part B when you first become eligible, and if you do not have some other health insurance that is considered creditable coverage, you will have a penalty when you sign up for Medicare Part B. Medicare Part B covers doctor's services, outpatient hospital care, including chemotherapy, emergency room visits, ambulances, blood and lab work, durable medical equipment, diabetes testing supplies, some home health care, and some covered preventive services. So again, this is really the bulk of your coverage because most of your health care that you get comes in these forms, and that's what Medicare Part B covers. Now, what Medicare does not cover, and this is something that we're going to have to advocate for in the years to come, but unfortunately, Medicare really does not cover vision services. It will cover cataract surgeries and glasses in between surgeries, but most of us who need eyeglasses or contact lenses unrelated to any surgery will not have it covered by Medicare. Medicare also does not cover dental. So dental care is an out-of-pocket expense for most people with Medicare, unless they have some other kind of coverage. It also, unfortunately, does not cover hearing aids or long-term care or custodial care. So now about Medicare Part A and Part B enrollment. Enrolling in Medicare Parts A and B is through the Social Security Administration. You will be automatically enrolled if you are drawing Social Security retirement benefits or after you have been receiving Social Security disability payments for 24 months. Social Security will send you your Medicare card in the mail. Now, if you are not taking your Social Security benefits, you need to actively sign up for Medicare through Social Security. So some folks delay taking their Social Security benefits because they are still working. However, they have become eligible for Medicare coverage. So you can get your Medicare coverage even as you delay your Social Security payments. And everybody who ages into Medicare or becomes eligible for Medicare will have what's called an initial enrollment period, an IEP. And this initial enrollment period lasts for several months. It begins 3 months before you turn age 65. It includes the month of your 65th birthday, and then it continues for 3 months after you turn 65. If you happen to miss your initial enrollment period and you do not have special enrollment due to loss of coverage from your employer or something like that, you can enroll during what's called the general enrollment period for Medicare. This is January 1 to March 31 of each year for coverage that will begin in July 1 of that year. Now, let's talk about the Part D prescription coverage. So Medicare approved private insurance companies offer prescription drug plans with different premiums and different forms of coverage. These Part D plans help to cover the cost of your prescription drugs. Each plan does have different formularies and tiers, which the tiers are lists of medications that they will cover and at what proportion they will cover those medications. And they also have different pharmacy networks. There is a penalty if you do not sign up for Medicare Part D when you become eligible, and if you do not have any other coverage that is deemed creditable. Enrollment is through Medicare during your IEP or when you lose creditable coverage, as well as during the annual open enrollment period. These are those enrollment periods that we just talked about a few minutes ago. Okay, now we're going to talk about different coverage options, including Advantage plans and supplements. So the reason it is very important to talk about this is because, as you saw, if you just have original Medicare, you're going to have quite a few out-of-pocket expenses. You're going to have a monthly premium for Part B. You will have deductibles for Part A and B. And when you use your Part B to go to the doctor, to the doctor's office or to have procedures, you're going to have some out-of-pocket responsibility because Part B on average only covers about 80% of your Medicare approved expenses. So a lot of people like to add additional coverage to their Medicare. So there's sort of two different tracks that you can go down. The first one, which is the one that you see on your left, is when you keep your original Medicare, you have your red, white, and blue card, and it covers your Part A and your Part B expenses. Then you also pick a Part D plan to cover your prescription drugs. Now, some folks might decide early on when they join Medicare that they might want additional coverage through a supplement, also known as a Medigap policy. So then they would have basically 3 different prescriptions. They would have their original Medicare, they would have 3 different forms of insurance coverage, all that work together with Medicare. They would have their original Medicare, they would have their Part D for prescriptions, and they might have supplemental a Medigap policy to cover their out-of-pocket expenses. Then the other track is on the right side, which is the Medicare Advantage plan. This is the Part C plan that at the beginning I said we would talk about later. Basically, Medicare Advantage plans just wrap all of these different forms of coverage into one plan. So you're just dealing with one health insurer. And it usually comes in the form of a private HMO or PPO, and they will cover your Part A and Part B expenses as well as your prescriptions. And sometimes they will offer additional benefits as well. So let's talk about Advantage plans for a couple minutes. When you enroll in an Advantage plan, the insurer takes care of your Part A and Part B benefits and also your Part D, your prescription drug benefits as well. Now, they may also offer additional benefits that are not covered by original Medicare, including some hearing, vision, and or dental benefits. So for a lot of people, Advantage plans really take care of their out-of-pocket expenses related to Medicare, but also give them the additional coverage that traditional Medicare does not include. If you sign up for an Advantage plan and you are unhappy with it, you have from January 1 through March 31st to drop out of it and either switch to a different Medicare Advantage plan or go back to traditional Medicare and add on a Part D plan. So this fall, if you choose a Medicare Advantage plan and you end up being unhappy with it, just remember that you have a period from January 1 through March 31 where you can make changes to your coverage. Okay, now we'll talk about supplement or Medigap plans. Supplement or Medigap policies cover what Medicare covers and they go where Medicare goes. Okay, under Advantage plans, a lot of times you are limited to a network of providers. For example, if you have an Advantage plan and you live in Champaign County, a lot of your providers are going to be in network with that Advantage plan. If instead you choose to have traditional Medicare with a supplement, you are not limited to a network of providers. You basically can go to any healthcare provider anywhere in the country who accepts Medicare. If they accept Medicare, they will accept your supplement, your Medicare supplement. So if you are somebody who travels a lot or spends part of the year in another part of the country, you might really want to consider a supplement plan. Now, these Medicare supplements, they help reduce the 20% co-insurance out-of-pocket expenses that you would have with your Medicare Part B. And they also take care of covering the deductibles. So they reduce your out-of-pocket expenses in that way. Now, unfortunately, they do not include prescription drug coverage. So if you do have a Medicare supplement, you will also probably want to add a Medicare Part D plan for prescriptions. Now, these supplement plans have different levels of coverage. They are organized and sold by plan levels. So this is helpful in comparing plans because, for example, a Plan G policy from one company is the same as Plan G from another company. In other words, the federal government regulates what the different plan levels must include and must cover. Now, some companies do not sell policies at all of the different levels, but they must offer at least a Plan A policy. And companies will no longer be selling Plan C or Plan F policies to newly eligible Medicare beneficiaries. So in a moment, we'll talk about what those different plan levels are, but it's important to know that the supplement Medigap open enrollment period is a one-time 6-month period when a Medicare beneficiary first enrolls in Medicare Part B. This is different than Medicare Advantage plans, which you can choose to enroll into a Medicare Advantage plan at any point in your lifetime while you have Medicare. But supplement plans really only work well if you choose them during your first 6 months of being new to Medicare. And as long as you apply during this period, you cannot be turned down for coverage. In other words, it's guaranteed issue. it doesn't matter what your health status is, what your medical claims have been, or what your medical conditions have been. But this is true only for the 6 months when you first become eligible for Medicare. Now, these policies for supplement plans must be sold guaranteed renewable. What this means is that if you sign up for a Medicare supplement when you first get into Medicare, these policies must be renewed for you every year. That is a guarantee. They cannot be canceled due to your increasing age or a change in your health. They can, however, be canceled due to late payment or false statements in the initial application. With these policies, the goal is to get a plan and stick with it. You are not switching these plans every year. After your initial enrollment, there aren't annual enrollment periods. So if this is the plan you want, the goal is that basically you're going to stick with it. Now, what you can change every year is your Part D plan, but not your supplement. So this slide here shows you the differences between the supplemental plans and the Advantage plans. Remember that the Advantage plans are that Medicare Part C, where you can purchase a private health insurance plan called a Medicare Advantage plan, and it covers everything together at once. It covers Part A, Part B, your prescriptions, and may give you additional benefits. So you can see that under supplements, the supplement is an add-on to your Medicare, whereas an Advantage plan basically replaces all your Medicare. Supplements have the same benefits across companies, but under Advantage plans, their benefits may vary. With supplements, you have no network limitations generally, whereas with Advantage plans, remember, it's typically a PPO or an HMO, so it's going to have network limitations. Under a supplemental plan, Medicare pays first, then the supplement will come in and pay any remaining costs. And again, the supplement plan only covers whatever Medicare covers. Whereas with an Advantage plan, the plan pays and then you pay any remaining copays or co-insurance. And it can cover additional services that Medicare doesn't cover, including vision, hearing, and dental. Now, supplements tend to be more expensive, whereas Advantage plans tend to be more affordable. Under supplements, they will price the supplements differently based on age and tobacco rating, whether you're a smoker or non-smoker, whereas with Advantage plans, they don't base the cost of the plan on that. And supplements may have medical underwriting, which means that they look at your health history and all that. But if you sign up for a supplement within your first 6 months of Medicare, that is not going to count against you. Medicare Advantage plans have no medical underwriting. So there are trial options for Advantage plans. So when you first qualify for Medicare due to turning age 65 and you join a Medicare Advantage plan, you have a trial period. You can drop that Advantage plan within the first 12 months and you can switch over to a Medicare supplement with guaranteed issue and with no pre-existing wait period. So this is the only time in your Medicare tenure that you can do this, that you can go from an Advantage plan to a supplement basically with no penalty for doing so and with guaranteed issue. When you first purchase a supplement policy, you also have a free look period of 30 days. What this means is that during that time, you can try out your Medicare supplement policy and you can cancel your policy during that first 30 days and you will be refunded your full premium. Also, it's important to note that you cannot have both a supplement and an Advantage plan. You choose one or the other. Thank you.
All right, and I will take it from here. My name is Adani Sanchez. I'm the Client Services Coordinator for Champaign County Healthcare Consumers, and I'll be talking about the annual open enrollment period, which is what we're in right now. It's from October 15th to December 7th. every year it's the same open enrollment period. So every year from October 15th to December 7th, people can choose different Advantage plans or prescription Part D plans. Like we said earlier, supplement policies do not have a kind of open enrollment period. After you're on Medicare, you can apply for different supplement plans even after you've initially signed up for one, but it's not necessarily guaranteed that they'll accept you. So it's like you have to apply for supplements. If you have extra help or if you have full Medicaid, you can switch Advantage plans or prescription plans throughout the year. So for those folks, they're not limited to the open enrollment period, but generally everyone else who does not get those programs, they have to limit their changes to that October 15th to December 7th. In 2021, we have 31 plans available. The premiums range from $7.30 a month to $147.80 per month. So there's a lot of variation on all the plans and how much they cost per month. The maximum deductible for prescription plans in 2021 is going to be $445. But again, that also varies between plan to plan. And it also depends on if you have some of those programs that we talked about, like extra help, or if you have full Medicaid, that is not going to be the same for you if you have those programs. So again, not every plan is going to have a full deductible. Some of them will have a $0 deductible. But again, it's just going to vary on what your specific situation is. And we always encourage people to look at more than just the premium. How does that plan cover your prescriptions? How does it fit your situation? There are different phases that are going to affect what you pay out of your own pocket. So again, if your plan has a deductible, that's going to be the first phase that you're in. So you have to pay the full price of your prescriptions up until $445, and then your prescription plan is going to start discounting your prescriptions. So once that happens, that's called the initial coverage phase. And so that's going to be the phase where you're going to be paying your regular copay. And then after you and your health insurance company have spent a certain amount, you're going to be in phase 3, which is called catastrophic coverage. And so that's going to be where your prescriptions are deeply discounted and your health insurance company, your prescription plan company is going to help you pay more of your prescriptions. And some of y'all might know about the Doughnut Hole, and technically there is no more Doughnut Hole thanks to the Affordable Care Act. Instead, there's this little thing kind of called a coverage gap phase, which is what happens after you've met your deductible and after you and your health insurance company have spent about $4,000 combined. So both of y'all together. So this is going to incorporate the retail cost of your prescriptions in the cost of this, in reaching that level. And so in that coverage gap, you'll pay up to 25%. Which is, it used to be you had to pay the full amount. When you were in the Doughnut Hole, you'd have to pay 100% of your prescription costs. But now in the coverage gap, you'll pay up to 25% of the cost of name brand and generic drugs until you reach $6,550, which is when that final phase of catastrophic coverage kicks in. So once you reach that $6,000 mark, you will be in the catastrophic phase. And so that greatly reduces your out-of-pocket cost for the prescription. So you'll pay no more than $3.70 for generic drugs and $9.20 for brand name drugs, or 5% of the cost of the drug, whichever is more. The cost you pay during the coverage gap is capped at a percentage of what the plan pays for that drug. So there's no more Doughnut Hole, but there is going to be a phase, possibly if you do have higher prescription costs, there is going to be a point where you might be paying more for your prescriptions than just the initial copays that you were paying. So the way that looks like in practice, So first you've got to get through your deductible. So if you have Miss Smith, she's going to pay the first $445 of her drug costs before her plan starts to pay its share. So she's paying full price for her prescriptions out of pocket. And she's got to keep paying that monthly premium. So that's another out-of-pocket cost that you have to keep in mind. Phase 2 is the co-payment or co-insurance portion. So that means Miss Smith is paying just the regular co-pay for her plan and for each of her prescriptions until combined, they reach $4,130. Now, once you've reached that point, you're in the coverage gap. So now she's at $4,130 for covered drugs, and she's going to get a 70% discount from the drug manufacturer on brand name prescription drugs, and that's going to count towards her out-of-pocket spending. And so then in 2021, she's going to get an additional 5% coverage from her plan on covered brand name drugs and 75% coverage on generic drugs while in the coverage gap. So she's going to pay that reduced amount. And then in catastrophic coverage, she's going to get to that point once she and her plan have spent $6,550 out of pocket for the year. And so now that she's in that catastrophic coverage, it's going to be an even bigger discount, that $3, the $9 for brand name drugs. So that's kind of how you move through the phases. In 2021, the Advantage plans in our area, there are going to be about 22 plans from 5 different companies. So again, there are certain companies, but each of those companies is going to offer different plans, and the plans are going to look a little bit different. The premiums range from $0 per month all the way up to $165 per month. So again, like we talked about with the prescription plans, things to consider: does it actually cover your doctors and hospitals? Again, Advantage plans are usually bound to networks, and so they're only going to pay for people who are in their networks. So you want to make sure that the doctors that you see, the hospitals that you go to, you want to make sure that those are in the network. How does it cover the services that you use regularly? Do you get a lot of x-rays done? Do you get a lot of blood work done? These are the things that you want to make sure have lower costs or are covered very well on these plans. And does it cover your medications? Advantage plans are going to usually include prescription drug coverage, so you still want to make sure that they're covering your prescriptions. And look at more than just the premium each month, because it's not going to be very helpful for you if you have to pay all your prescriptions out of pocket on a free Advantage plan because that Advantage plan didn't cover your prescriptions. So that's not going to be a very good deal for you. When you're getting ready to sign up for an Advantage plan or getting ready to look at a prescription drug plan, if you're already on Medicare or on a prescription plan or Advantage plan, you're going to get a notice of changes from your company. And it's going to say, this is what we're changing. Our premium is going up. It's usually going to go up just a little bit. Their network is changing. Their prescription coverage is changing. So it's important for you to read the mail that you get from your particular company, just because it could include notice of changes. You want to review that information. You also want to review information from Social Security and Medicare. They send out information about those programs that we talked about a little bit earlier, like Extra Help or Medicaid. So you want to take a look at that information and just make sure you might be eligible for some of these programs. And check your plan. Maybe you didn't get anything in the mail and you're feeling really good about it, so you're just going to kind of not do anything. But I really encourage people to just take a look at your plan. You can just give them a call and check the information. Formularies change, networks change, and they don't always make it obvious or make it clear that those things are changing. So I always encourage people, even if they really like it, just double check that all your things are covered, your doctors are covered, and your prescriptions are covered. You can review and switch information. You can do it all online if you're comfortable on the computer at www.medicare.gov. You can also do it over the phone by calling 1-800-MEDICARE. You can also do in-person appointments with a SHIP counselor. And we're also offering remote appointments as well at Healthcare Consumers. What you need for open enrollment is your Medicare card, so the red, white, and blue card that you got. your list of doctors with names and phone numbers, and a list of your medications. If you use your pill bottles, you can actually see the dosage, and you can make sure that your prescription list on Medicare.gov is really accurate because it'll include dosage. Again, if you need help, we're available. We can do remote appointments, or we can help you find a local SHIP counselor. So these are the local SHIP sites in our area: Champaign County Regional Planning, Family Services Senior Resource Center, OSF Heart of Mary Senior Programs, and the CHRIS Senior Services in Urbana. Now, if you're new to Medicare, it is a little bit more of an intensive process. You just want to make sure, depending on what your situation is, that you're taking the right steps to get covered and make sure that you've got the coverage that you need. If you have employer coverage, check in with your employer to find out exactly what you need to do. If you have creditable coverage, you don't necessarily have to sign up for Medicare, but in some instances, employers do recommend that you sign up for Part A, but maybe just wait on Part B because you still have that, outpatient coverage. So your employer can tell you what you need to do and what your next steps will be. And if you are going to sign up for Medicare and have your employer coverage, your employer can clarify whether your Medicare is primary or secondary insurance, which can make a really big difference when you do actually get care, because if neither of them want to pay, it becomes a really big issue. So checking in with your employer to figure out what the steps are that you need to take. Typically, if the employer has less than a certain amount of employees, you do need to sign up for both Part A and Part B, and Medicare would be primary in that situation. If you stop working or your employer group coverage ends, you have 8 months to sign up for Medicare without penalty. So that would be one of those special enrollment periods where you wouldn't be penalized because you lost your coverage. And so even though maybe you've already turned 65, a couple of years ago, you would still be able to sign up for Medicare without a penalty because you had creditable coverage at least 8 months ago. If you have retiree insurance, it's important to talk to your benefits coordinator to find out what you need to do and what is offered. They have different plan options. And so if you're a retiree, you might have additional options available than just what's offered on Medicare.gov. So it's important to check in with your coordinator office just to make sure that you know what your true options are and what you need to do. Sometimes if you did sign up for something on Medicare.gov, you could still go and do that, but sometimes it would block you from accessing that retiree coverage again. So we just encourage people to check in there first before they pick anything on Medicare.gov, just because it might keep you from being able to access your benefits in the future. And be aware that if you choose an Advantage plan or supplement that's not part of your retiree benefit package, you may jeopardize benefits you're receiving, including health coverage or pension and annuity payments. So again, double check with your coordinator office. Once you opt out of their benefits, you can rarely get back in. If you have VA coverage or TRICARE, you're probably not going to need Medicare Parts A and Part B. But if you have additional questions, you can contact this office. You can contact the office on the screen. If you have VA benefits, it does count as creditable prescription coverage. You do want Medicare if you want to get coverage that's not at a VA facility. So we do recommend doing that. And if you have more questions regarding VA benefits, you can call the number on the slide. If you are on the marketplace, if you have private health insurance through healthcare.gov, also known as the marketplace, you do need to terminate that coverage. You cannot have both marketplace coverage and Medicare at the same time. You can terminate that coverage online or by phone, and we can also, at Healthcare Consumers, we can also help terminate that coverage. You can terminate your plan as early as 60 days before your Medicare starts, and it does take a little bit of time to terminate that coverage. So we recommend that you do that in advance ahead of time. So don't wait until the last minute. If you have Medicaid, The situation is just a little bit different when you're moving into Medicare, because you can have both Medicaid and Medicare, but the requirements change. Income now has to be at 100% of the federal poverty level, and assets are now considered when determining eligibility for Medicaid, whereas previously they might not have been. So if you had Medicaid as an adult, they probably hadn't asked you for asset information, but now they're going to ask you things like, how much do you have in your savings account? Do you have any stocks, bonds? They ask you about that kind of stuff, and they ask you, how many vehicles do you have? What kind of property do you own? So that's kind of what they want to know. So now it looks a little bit different. You can have both Medicaid and Medicare, but you might not always continue to qualify for Medicaid because the requirements change. And you can see that the monthly income levels are $1,088 a month for one person, and the asset limit is $2,000. So the income requirements go really low. Medicaid would be secondary coverage, and it would cover the additional things that Medicare does not, like vision and dental. If you have both Medicare and Medicaid, you still need to have Part D coverage for prescriptions, because Medicaid is now going to be a secondary insurance, so they're not going to want to pay for your prescriptions anymore because they're going to be secondary. If you qualify for Medicaid, you really don't need a supplement or an advantage plan. Medicare pays 80%, Medicaid would pick up that 20%, and it would include those additional benefits like vision, dental, and hearing aids. Thank you.
Hey everyone, my name's Chris, and I am a community health worker with Champaign County Healthcare Consumers, and I'm going to go over a few of the additional resources that we have to make your Medicare work for you. So first off, we have the Medicare Summary Notice. So this is something that you get from Medicare, and it has an explanation of benefits from your Advantage plan. So for example, everything that you got done that year, you could see what Medicare paid for, and then you can kind of use that as a guide to help you prepare for the upcoming year to see what changes you might want to look into. If you have grievances and you would like to submit an appeal, if you have original Medicare appeals go through Medicare. For Part D and Advantage plans, you have to start with the plan's internal appeal process first. Other additional assistance programs. So as was previously mentioned, there are things that can be done to help cover some of those costs, like Part B premiums. So the Medicare Savings Program is one of those. This helps with the premium, and it helps with the Medicare co-insurances. This is done through the Illinois Department of Human Services, so you would have to apply through them and get a determination from them to see if you qualify for this program. Another program is Extra Help. So with this program, it's an income and asset-based program to help with your prescription costs, and this one is administered by Social Security. So this would help with your premium. You would have no deductibles and no coverage gap as well. Additionally, we also have hospital financial assistance programs. So even if you have your Medicare and Medicaid, you might still want this as a safety net. Carl offers a financial assistance program where you can get additionally up to 100% discount on anything that you get done at Carl. OSF also has a program that's similar. Members can also qualify for up to 100% discounted on services for their out-of-pocket expenses through OSF providers. If you have a bill already from OSF, we can submit applications on your behalf and make sure that you can get those discounted bills as soon as possible. We also have additional programs to help with prescription assistance if you are transitioning, or if there's a month where you can't afford your prescriptions. We can help cover those co-payments while we search for a long-term solution. We also have additional programs for dental and vision. So as was mentioned earlier, Medicare doesn't have that coverage included in just traditional Medicare, unless you have an Advantage plan or other supplemental coverage. So through the dental referral program, we can partner you with a local dentist to help you get discounted services for any kind of dental treatment you might need. Same goes for vision. So you can get an exam, you can get a free pair of glasses, regardless of whether you're going through like cataract surgery, which is the one time that Medicare would cover vision care. And that concludes our presentation. We are still taking appointments via phone and Zoom meetings. So you can call us at 217-352-6533 or find us through social media.